Being in high school, we hear about drugs at one point or another, whether it's from a Say No to Drugs lecture or even hearing about it through friends. While these drugs are talked about, they're never really explained in detail and leads to misuse and overdose. I'm going to talk about Xanax. The scientific name for Xanax is benzodiazepine. Some common street names are Z-bars, footballs, and handlebars. Although they are usually seen in an oval shape, they can also come in a bar shape. In most cases, the different colors are linked to the strength of the pill. Some of the paraphernalia used for Xanax are syringes, aluminum foil, and rolling paper. Being a depressant, it slows down the body's central nervous system. It can make the user feel more calm. It's unlikely to get addicted to Xanax, putting it at a Schedule IV drug. In the 1950s and 60s, there was a rise of psychiatric treatment. Researchers wanted to find ways to help people who experienced anxiety. A chemist named Leo Sternbach developed the first benzodiazepine called Librium. Research continued and eventually Xanax was developed. The FDA officially approved it in 1981. The active ingredient in Xanax is alprazolam. People can get Xanax into their bodies by taking it orally, crushing it and snorting it, or dissolving it and injecting it into their body. They work in the brain by binding to the benzodiazepine receptor called BZD1 on the GABA chloride channels of neurons. As they bind to the receptors on chloride channels, the frequency of chloride channel openings are increased, letting more chloride into the cell. The brain gets excited because something called RAS sends signals for excitement to the cerebral cortex. Benzodiazepines inhibit these RAS neurons, and the cortex gets less excited. This results in sedation or a hypnotic effect. Benzos also inhibit the limbic system, which decreases emotions such as anxiety. In our bodies, we have a group of cells that help to prevent an excess amount of dopamine. By slowing down the rate, dopamine is released. Benzodiazepines weaken this group of cells, causing a greater release of dopamine in the body. The pleasure that comes with dopamine is what gets people to get addicted. They are constantly wanting that feeling back, and they will do anything to get it. Xanax has a quitting rate of 70 to 80%. Some of the long-term effects are memory loss, depression, anxiety, weakness, and headaches. Withdrawal symptoms can be different depending on the type of benzos taken. Some symptoms are twitching, dizziness, stomach issues, and delusions. Symptoms can last from a week up to a whole year. Illegally possessing a Schedule IV substance such as Xanax is a felony that requires 1 to 5 years in jail. Distributing it is also a felony and it can result in up to 10 years in jail. To know if someone has Xanax in their system, a blood test, a urine test, a saliva test, or a test on the hair with a follicle attached can be done. To test if an unknown substance is Xanax, a mass spectrometry test can identify it. I hope you've learned a lot from this information and used it wisely. Personally, I've learned to never make a stop motion again because this thing took 2,964 pictures and hours of my life that I will never get back. Also, I think I spelled schedule wrong.